Welcome to everybody, and welcome to the inaugural webinar of our new Code Red for Climate campaign here at the Canadian Association of Physicians for the Environment. We have a great panel for you here today, that it is Clean Air Day and World Environment Day. We're celebrating under much better conditions than last year. Well, some of you will remember that we had the worst air quality day ever on Clean Air Day 1 year ago, although it is a lot of sweltering heat where I am calling in from. And I would like to open up with a land acknowledgement. I am on the unceded territory of the Kanekahake people, otherwise known as Montreal. And today, as I mentioned, it's World Environment Day. And of course, we know that Indigenous peoples is currently stewarding about 80% of the Indigenous peoples' lands occupy about 20% of the territory globally, but they are stewards of 80% of global biodiversity. So when we think about environmental justice here on World Environment Day, there is, of course, no environmental justice without land back and money back. So I would really like to acknowledge their stewardship of the land over millennia. And I invite everybody to introduce yourselves in the chat so we can know who's here and who's joining us today, even though we might not all be able to see each other. And feel free as well to put in any wishes, something you would like to share about World Environment Day. Feel free to also acknowledge the territory that you're on. And we will move on now to presenting our panelists. So we have 4 speakers today. First, we will hear from Rob Barnes, who is the Climate Director at CAPE, and he's going to present about the Code Red for Climate campaign. And next, we will hear from Courtney Howard, who is an emergency physician based in Yellowknife in Chief Draigie's territory. And Courtney has been with CAPE for a very long time in many roles. She currently sits on the board of the Canadian Medical Association and the Global Climate and Health Alliance, has been a key member of the Lancet report, and I could go on and on and on, but you will get to hear from her shortly. After that, we will hear from Dr. Sehjal Bhargava, who is a public health and preventative medicine and family medicine resident physician at the University of Ottawa, originally from Saskatoon. She is the founder and a past member of CAPE Saskatchewan and the current co-chair of CAPE Ontario, as well as a member of CAPE's board. And our third panelist is Louise Comeau, PhD, who is the senior advisor at Re.Climate, Canada's go-to centre for training, research and strategy on climate change communications. She also sits on Canada's Net Zero Advisory Body and has worked in both academic roles as well as with a large number of Canadian environmental nonprofits. And she holds a PhD in environmental management and specializes in climate communications. So as I mentioned, Rob is going to talk about Code Red for Climate. Courtney will talk about wildfire impacts. Sehjal will talk about extreme heat and other climate impacts. And then Louise will talk about the capacity of CAPE's, of the kind of physician voice and messaging about climate and public health issues. So I will turn it over now to my colleague, Rob Barnes. Take it away. And great, I see
Thanks, Leah, and
comments coming from the chat. So lovely to hear from you all.
the chat is open. Yeah, and thank you so much, Leah, for that introduction. I know I'm standing between you and our amazing presenters. I'm here to just give you a quick overview of the Code Red for Climate initiative. that CAPE is rolling out. This is the first of, I think, many occasions over this summer and fall where we're going to be talking and using this frame. So without any further ado, I'll share my slides now and just give you a quick walkthrough some of the kind of fundamental elements of the campaign. So where do we start? Well, you're here. Thank you for taking the time to attend what we, I think we're tentatively concluding is the most well-attended webinar in CAPE's history. Very, very happy to have you here, be part of this. And Code Red for Climate, we're launching this initiative and we're calling on policymakers to stop, drop, and roll. We're using a little bit of fire safety best practices in our communications here. What is this all about? Well, let's talk about the context. And I think everyone on this call is well aware of the context. I see Courtney in Yellowknife, and I know many of us across the country endured a wildfire season that was exceptional last year, and signs point to another difficult wildfire season for this year. So the urgency of responding to climate disasters like this has never been clearer. So we're issuing a call to action, and we're borrowing from the hospital emergency code, that's code red, that denotes fire and smoke. So we have an opportunity here to take ambitious action while protecting the health of people across the country. As I said, we want to stop, drop, and roll. We want to stop fossil fuel disinformation. We want to drop emissions, and we want to roll out near-term solutions that save lives now. So what's the fossil fuel disinformation piece? Well, as many on the call know, the oil and gas industry is not a neutral player. They've invested billions in marketing and public relations campaigns designed to sow doubt about climate science and to push false solutions. And there's actually a really important private members bill going through the House of Commons right now. It's called an Act Respecting Fossil Fuel Advertising, colloquially known as an ad ban act. And I just saw today that the Secretary General of the United Nations is calling out fossil fuel advertising. It's a real moment for action on tackling fossil fuel disinformation. And Leah will have more information on how to take action on that at the end of this call. There are many opportunities right now. Canada is poised to take action on climate change in a variety of ways. There's an opportunity to lead on policy at the domestic level. And really, our eyes are on three key policies. One is the oil and gas emissions cap. One is new regulations for methane emissions. And another is clean electricity regulations. If we did all three of these things, we would see a sea change in terms of Canada's emissions trajectory. We need the political will to get there. And to get political will, we need pressure from folks like you, from the broader public, on policymakers all over the country. So we're calling on parliamentarians to urgently adopt these regulatory measures. There's more, again, to come about the steps you can take to take action on climate policy here. And then finally, rolling out emissions to save lives now. Many don't know about this. This is a bit under the radar, unfortunately, but Canada has something called a National Adaptation Strategy, and it's really a whole of government response to climate change, and it's designed to adapt and prepare for climate change while safeguarding people's health. But since its announcement, the National Adaptation Strategy has struggled to find funding and to be implemented. And so there's, again, an opportunity for us to urge parliamentarians to understand that climate impacts are no longer a distant threat. As we all know, we need real action now in order to save lives. So this is just the intro webinar. You'll be hearing a lot from us over the summer. Watch for this logo. There'll be webinars, there'll be petitions, there'll be all sorts of actions that you can take, ways that you can get involved with the Code Red for Climate campaign. And thank you again to our amazing panelists for setting the stage here this afternoon or this evening, depending on where you are. And with that, I'll stop the share and pass it along. Thank you.
Thank you, Rob. That was great. So yeah, please stay tuned and you'll be hearing a lot more about Code Red for Climate over the summer. And I will now hand it over to Dr. Courtney Howard.
Hi, everybody. Hello from Chief Dry Geese territory. These are the traditional lands of the Yellowknives Dene, the Welliday Dene, and the traditional territory and also lands of the North Slave Métis. I'm really happy to hear that STOP is part of the new CAPE campaign. I recently did a landscape review and gap analysis of medical curricula in Canada. And I realized that because we've been so slow at getting climate change and health into curricula, a lot of people are inadvertently working with the information that is sort of seeped in, which in most cases is disinformation. And so if you're a medical professional, please do some work, and we'll talk about this a little bit at the end, to really get evidence-based sources, including Lancet Planetary Health, Journal of Climate Change and Health, into your senior leaders' hands, because many of them don't know what they don't know, and they're working with a mental model that simply does not echo the risks we face. So this is the emergency department where I go to work. This is Stanton Territorial Hospital. We are the most northerly CT scanner in the middle part of Canada, and we serve a patient population that goes all the way up to the high Arctic. So it's actually an area that is bigger than France and Spain combined. These are my potential conflicts. We get paid very little to do this work, so most of this is speakers' fees from different universities. Now, this is something I hope never happens to anybody. I was giving a keynote on wildfires and health on the big stage in Ottawa last August, while my hospital was actually being evacuated due to wildfires. And to the point where a senior Canadian Forces leader was actually called away in the middle of my talk to go discuss the air evacuation of Yellowknife Hospital. So this is where we're at. When I started this talk, I said, I know that most of you have never had a lecture on wildfires or climate change, because that's what the curriculum surveys show. I've had 1,000-person audiences. I've asked them in the last 2 years, put up your hand if you've ever had a lecture on air pollution, and about 15 to 20% of hands go up. So we are entering this at a moment of really indefensible lack of preparation on behalf of the medical profession. And I do believe that living in the midst of fossil fuel disinformation has contributed to that. My friends never thought that they would have to evacuate a hospital. Our official plan was to shelter in place. However, like most disaster plans across Canada, that one was conducted without taking temperature and precipitation patterns into account. So most health systems in Canada, I actually just finished revising a paper with Greg Ciattoni, who wrote the disaster medicine textbook. Most health systems across really the world are working with a disaster management plan for yesterday's disasters and not the ones of today or tomorrow. So this is one of the reasons why implementing the National Adaptation Plan and getting this into curricula is so important. So this is my deck. Welcome to my deck. This is what the PM 2.5 reading was near the end of September. So 598. To put this into context, under 30 is considered low risk. 30 to 60 is medium risk. 60 to 100 is high risk, and over 100 is very high risk. So this was so far over very high risk that it just looked like pea soup, and it felt like pea soup. As many people know, this extended across the continent, and this is a patient getting evacuated on that military plane that I was mentioning earlier. So as doctors, we're asked and taught how to keep people stable within this complex self-regulating system that we walk around in every day. There's many different organs, many signaling molecules that all interact. We know that we have to intervene quickly while people are still stable, so that when our treatments enter that organ system, they can be met by organs and systems that are still functioning. When I resuscitate patients, what I aim to do is move as fast as possible, because by experience, we know that once organ systems start to shut down, our treatments work less well. We may have to admire a float plane taking off. Little bit of local color for you.
We hear you okay, though.
You?
Yeah.
Now, the problem is that we walk around on and within a complex self-regulating system every day too. And we need to be really thinking about what elements are critical to the stability of that system. Now, the framework I work with the most and like the best is the planetary boundaries framework. And like our different organ systems, we need to recognize that climate change is situated within all of these other different elements, with it and biodiversity being the most critical to the stability of the whole system. The problem is that we know that over 1.5 degrees Celsius, we enter a place where the system could start to tip into that positive feedback cycle, where it's going to be more difficult for us to prevent positive feedback loops that will prevent us from being able to stay in a stable state. That's why Antonio Guterres today said that the battle for 1.5 degrees Celsius will be won in the 2020s. And that's why he endorsed a fossil fuel ad ban, which was very exciting. We've just had the first 12 months over 1.5 degrees Celsius, so really things couldn't be more urgent. And abrupt permafrost thaw is one of the...
Courtney, can you talk closer to the microphone? Some people are having trouble hearing you.
Sure. So we're now in drought. Our water level behind me is about a meter lower than usual. This is what it looks like when we have bad smoke up here. So in 2014, we had more than double the normal emergency department visits for asthma over 2.5 months of bad smoke. When we asked people what it felt like, they felt separated from the land, they felt lonely. There was a reduction in physical activity because people were staying inside. Many people expressed ecological grief, saying, if it's this bad now, what does this mean for my kids? And the thing I liked the most was that the people who prepared the most and knew most what to do felt the best. Not only did they practically prepare in a more effective way, but they also said, hey, I knew what to do. I'm proud of what I contributed to my community. And that told us that preparation not only does good, but it feels good. And we need to be moving towards that type of world. Now, this is what our air quality looked like. As I mentioned, under 30 is safe. So over 2.5 months, we were very infrequently under 30. And what we see in the hospital is, and many of you will have lived this, when the air quality is getting bad, you get itchy, watery eyes, a low-grade headache, sort of feel lethargic. People with asthma start using their medication more. As it gets worse, we start to see more increased asthma exacerbations, chronic obstructive pulmonary disease exacerbations in the emergency department. And in fact, overall mortality actually goes up. We now understand that this actually has impacts on our cardiovascular health as well. So we're expecting to see about 2 days in more heart attacks, more presentations for hospital admissions for cardiac related issues. This is actually pretty new evidence. We hadn't really confirmed this until a couple of years ago. This is also new. So only in 2022 did we learn that there's probably an increased long-term risk of cancer as well. So this was a Canadian study, big study, looking at more than 2 million Canadians over 20 years, found a 5% increase in lung cancer and a 10% increase in brain cancer compared to a non-exposed population. That's huge. And I mean, when you think about the fact that that's 20 years ago, starting over 20 years ago, those were less bad exposures than we're seeing now. So I would expect those numbers to be at least matched, if not higher, moving forwards. Now, this is a very good tool that Health Canada has put together, the Air Quality Health Index. If you're a health practitioner and you want handouts on this, they will send you boxes of handouts that you can go through with your patients. Essentially, people with a higher level of pre-existing vulnerability, people who are pregnant, young people, people who work outdoors, people with pre-existing disease should do less at a given level of air pollution. Now, we're also starting to really appreciate the risks for pregnant women. So there's a risk of premature birth. There's a risk of decreased birth rate. There's even studies coming out showing that children who are exposed while they are in their mommy's tummy, in fact, can have increased levels of ear infections and lower respiratory tract infections in the first year of life. So really, really huge potential impacts, potentially long-lasting impacts on due to prenatal exposure. So what do? N95s are our friends. I have a whole bunch of N95s. We have ones that have been fitted for our children. They're purple, they're blue, whatever your child wants to wear. We get ours for Masks for Canada, and we wear them when it's smoky out. I have no desire to develop premature cancer as a result of PM 2.5, and I don't want my kids to end up having increased respiratory problems or potentially long-term problems. So I just stay inside with the windows closed, have an air filter inside, and try as hard as I can to keep up with whatever smoke burden there is. Now, we need to recognize that a lot of our hospitals were made before all of this, and they're not equipped to deal with smoke. So before wildfire season, we need to be looking at the building envelope, reevaluating our HVAC systems, installing indoor air quality monitors so we can keep up. And so what we want to do is aim for an air quality inside of less than 30 micrograms per meter cubed. Now, this will probably be met with some resistance. Who what facilities manager wants to know that now they have another job and that maybe increased expenditures might be required? This is one of the reasons we need to really increase investment in our national adaptation strategy. And as physicians, we need to be advocating for the patient. I've been talking to a lot of engineers who are looking at this top down, and they were advocating for an 80% reduction in outdoor levels. But as you saw, we had a 600 on my deck. That would mean 120 inside. I can't look a patient in the eye and tell them that they're safe in my emergency department if the PM 2.5 is 120. And so we're going to have to go to bat for this for our patients. The co-benefit is that it will also take a lot of viruses out of the air, and that will help reduce COVID spread as well. Now, we know we're not at a new normal, important to invest because we know that under all emission scenarios, we're going to continue to warm in Canada. And this is going to have real consequences for our kids. So we need to invest in adaptation, but I don't know anybody who wants to know what's going to happen on that red line, which is the line we're currently following. So we also need to emergently decrease greenhouse gas emissions. So number one, much more investment is needed in Canada's National Adaptation Strategy. And then we need a mitigation sprint as well, recognizing that we can contribute a lot in the health sector. We're responsible for 5% of global greenhouse gas emissions, and we allocate 10% of global world product. So there's many things that Kate can do outside of the hospital that also contribute to the overall decrease in emissions inside the hospital through decarbonizing the electricity that, for instance, feeds into our hospitals. But as healthcare providers, there's a lot we can do too, and we need to get better organized. We've already seen 83 countries commit to do that. 49 health ministers showed up at the last COP. The World Health Assembly just last week passed climate change and health as its #1 strategic priority in its work program between 2023 and 2025. As a nation, we're way behind. England already has 170 people working on this. They've got a national plan. They've costed out, they've baselined their emissions. They've met their first 2-year targets. We need to get organized, and that means we need to bug our provincial ministers of health, territorial ministers of health, and national ministers of health. And as a health sector, using universities, using our health associations, we need to ourselves get organized to help fund this. I made this large map that indicates what needs to be done. This was as part of a project I did funded by Health Canada through the Association of Faculties of Medicine of Canada. Every single thing in purple is something that needs to be built. So the advocacy skills that you are learning through CAPE are going to be well needed in order for us to really meet the challenge of healthy people and healthy health systems in this climate changed world. I'm so glad to see so many people here on World Environment Day, and I'm very excited to work with you on creating the healthy future together that we all need. So thank you, and I'm looking forward to my lovely Sehjal.
Wonderful, amazing work, Courtney. I hadn't seen that that map before, so I definitely want to have a deep dive into it. So without further ado, I will pass it over to our next panelist, Sehjal Bhargava. Dr. Sehjal Bhargava.
Thank you. Thanks, everybody. And Courtney, I hate following you. This is going to be tough. But my name is Sehjal. I'm a resident doctor in public health and preventive medicine and family medicine. Almost done the family medicine training component of my training in Ottawa here. And I'll be going to Harvard next year to hone in on some health policy skills to do a master's in public health. And this presentation is an overview of the work I've done with extreme heat adaptation, specifically pertaining to the NAS, which Dr. Howard brought up a lot in her conversation and in her presentation. So the climate context of this is that we are experiencing extreme heat events more than we've ever experienced them in the past. We're seeing all kinds of health impacts ranging from heat waves resulting in wildfires. We're seeing permafrost thawing, oh my gosh, viral vectors changing, and the Rideau Canal being slushed the last 2 years. We're seeing tons of worsening health impacts. And throughout Canada, each of these health impacts are felt really differently, which is why I always like these maps to be demonstrated. BC heat dome, the Fort McMurray fires, really early evacuations in the year. And then obviously we can't forget like Lytton, BC as a perfect example of the way that extreme heat leads to wildfires and the health impacts that come from extreme heat, not just from feeling extreme heat, but also the downstream consequences of that. These are headlines from recently, and that we see in the news almost every day. It's becoming almost common to know that, whether to think about whether going outside is safe that day. And I think that that's a really scary place to be. Like we know the health benefits of spending time in nature. I personally think of like going outside as my safe space. I'm going to go for a walk. I'm going to go de-stress. And now thinking that I have to like check and make sure it's safe to go outside is really a scary thing. And then even thinking about the way that I treat my patients inside, like Courtney demonstrated, like if the air quality index is so high outside, what's it even going to be like inside? And especially when we think about the people who have less of an ability to adapt to these threats, you think about the health consequences that are going to come from this, and that's where mitigation plays a large role. So I woke up this morning to this auto will experience a one-day heat event on Wednesday, and we truly did. I think it got up to like 32 degrees today. And I saw some more patients in my walk-in clinic coming in with extreme heat kind of symptoms like the dehydration and dizziness. So it's already happening today. This is our current adaptation strategy for extreme heat. The NAS doesn't have a lot of funding. It's a really well-developed strategy, and I had the pleasure of being a co-author on it. But like as Dr. Howard summarized, there is currently not a lot of funding, and there's not a lot of emphasis being put on it year after year in the federal budget. So currently, this is the circumstances we see, and this is how people are going to be dealing with extreme heat at a personal level until we can actually come up with some sort of public infrastructure and strategy to support adaptation to extreme heat and mitigate the ground level temperatures that we see. So why is extreme heat exceptionally important? When we talk about climate change, the consequences of increased CO2 in our atmosphere, I'm thinking of like the intersections between floods, between wildfires, between heat, between drought, and then the recovery needed to come back from all of those natural disasters. But extreme heat is so important to health, and I think important to us as spokespeople with backgrounds in health, because it's the most natural, or it's most deadly of the natural disasters. The heat dome in BC caused over 600 deaths. Most of those deaths occurred indoors and were people who are adults or older adults with medical comorbidities who couldn't access cool air. This causes deaths, and this causes mortality, and this causes ER visits, and this causes increased pressure on our healthcare system. With climate change worsening, the duration and severity of heat events will continue to worsen. And at present, without the implementation of the NAS, the National Adaptation Strategy, we are wholly unprepared for these extreme heat impacts, especially when it comes to more vulnerable Canadians. And so I wanted to really, in my work with the NAS, I wanted to come at it from a lens of health equity and from understanding that the people who are the most vulnerable to extreme heat are the people who typically fall through policy gaps. So those who are unhoused, those who are elderly, those who don't speak English, those who don't have access to the internet. And so it was really interesting to try and develop high-level policy infrastructure and frameworks that were going to target the most vulnerable of people. And that was my biggest takeaway from this strategy and from my research for this strategy. You'll see in the bottom left, one of our meetings with Minister Guilbeault to pitch the work that we had been doing. So populations at risk for extreme heat, like I mentioned, this is a graph, but I'm going to tell you a patient story instead. So let's call her Georgia. Georgia walked into the ER. Well, she didn't walk in, she was wheeled into the ER because she'd been found outside. When I took Georgia's history, I called, her place of living, and she'd come from a long-term care facility. The air conditioning wasn't working really great. And so she, being a person living with schizophrenia, went outside for a walk, got really confused and couldn't tell that she was hot, and was found passed out under a tree. And this is not an atypical story, unfortunately. There's lots of health comorbidities that make people more sensitive to heat and less able to tolerate its effects and less able to thermoregulate and adapt to it. And the last thing I want is to see more people like this in the emergency department or coming into my family medicine practice. And so once again, this emphasizes the importance of actually investing in these strategies to target our most vulnerable people and our most vulnerable populations to reduce these risks. So the urban heat island effect, I think, is something that I learned about while I was doing this research, and I found it really interesting and something I want everybody to be aware of. So when you look at natural infrastructure, green and gray infrastructure, you can see that it wavers depending on what natural structures are around you, or what man-made structures are around you. So if you take a look at the most left side of the graph, you can see rural, suburban, and pond. And you can see dips in the daytime ground level temperature. And notice that the air temperature is the same across all of these scenarios. Then when you're in the downtown or urban residential or even urban Even suburban populations, you see that the ground level temperature is actually increased. And that's because of the presence of high-rise buildings, lots of cars, lots of asphalt, lots of cement, things that absorb heat and keep it in there and block wind flow. And so we see increased ground level temperatures in urban settings, which makes, adaptation work really important when it comes to dealing with people living in the inner city, living in environments that are more industrialized, like people of color and communities of color living in industrialized areas, coinciding with the concept of environmental racism. These concepts are always like in flux and intertwining, which makes, I think, climate policy so exciting, but also really challenging. So this is the overview of the NAS and the National Adaptation Action Plan. You can see that those are the 5 areas that we're focused on. We provided long-term transformational goals and then as well as medium-term objectives to reach these goals with the guiding principles listed in the box to the right. Highlighting the fact that we wanted to respect and uphold Indigenous jurisdictions and rights. And it's been interesting to watch that play out. So this is the draft of like the extreme heat policy I came up with the NAS that I like pitched forward for the first time. It's my first time working with a logic model, coming up with like foundational prerequisites that ended up in targets. And this ended up not even being close to what we came up with in the end. But this was how the Treasury Board wanted the report done. So I had to learn how to put all of these like health-related, equity-based concepts into like government talk. And so I thought it was really interesting to see how this started. And then how this ended was something like this. So you see our goals ended up being focused on reducing the mortality and hospitalizations from extreme heat through improved alerts, enhancing community resilience, improvements in the built infrastructure, and investments in natural infrastructure. So community, our surroundings, and improving our green space and environment. And the targets were going to be based on reduced mortality and reduced hospitalizations with a vision 0 of excessive deaths from extreme heat by 2040. And I remember being in a meeting with Minister Guilbeault, and he saw this and he goes, 0 deaths? And I was like, yep. 0 deaths. Like no death is okay, right? When it's completely preventable, and it can be prevented if we have the right policies in place. So this is some of the ideas and some of the breakdown of the concepts between green, gray, and community connection. So when I talk about green infrastructure and the things that we can think about advocating for if it comes to wanting to adapt and be prepared for extreme heat, you can think of things like increasing and preserving tree canopy coverage in your neighborhoods, or thinking of neighborhoods that would have less tree canopy coverage. For example, we know that communities of color and more marginalized communities have, on average, less tree canopy coverage than better off or more higher economic status neighborhoods do. Protecting urban waterways and reversing the loss of biodiversity in our cities is a huge issue. And we know that the more we preserve nature, the lower those ground level temperatures come. And if we replace and preserve natural waterways and natural wetlands, the ground level temperature will naturally decrease. Gray infrastructure is concerning our built environment. So thinking of ways to create shade, ways to create heat resilient buildings. I love, and think this is something that's going to be coming up more and more, is a maximum indoor temperature. So we have maximum cold temperatures, but we don't, or minimum cold temperatures, but we don't have maximum heat temperatures. So this coming in from a municipal or even a provincial or landlord standpoint is something to watch out for and advocate for, absolutely. Things like heat resilience assessments in buildings can be really important to assess what types of materials and what makes a building heat resilient and heat safe. Thinking of reducing vehicular traffic, increasing ventilation, and expanding artificial shade structures. The community connection piece is the cheapest, the quickest, and I think our biggest bang for our buck. So we need to actually map and assess where people who are vulnerable to extreme heat live. Homeless shelters, high-rise buildings, subsidized buildings, and map out where they are and actually create targeted interventions using community groups and community-based clinics and seniors outreach programs and paramedics and emergency response services to wrap support around these people in the event of an extreme heat wave. Heat alert systems are going to be important for preparation, checking on our neighbor programs, public health communications on like awareness campaigns and emergency plan communication as well. So this is a screenshot. I have 2 slides left, but yeah, sorry.
Yeah. Okay.
I'm not seeing the chat. This is a screenshot from the NAS. These are actually the policy outcomes that came from the recommendations that we put forward. And these are the key principles that I wanted to emphasize in our response to extreme heat and things to advocate for. So using a lens of equity and health equity and using a whole of society and intergovernmental approach, extreme heat should direct interventions to those identified as most structurally vulnerable, educate and empower people and communities, focus on preparation, not reaction, early alert systems, and enhancing resilience through community connectivity, green infrastructure, and gray infrastructure. Sorry, I took up too much time, but that is it. Thank you. And looking forward to any questions that you guys have. And yeah, thinking about ways to get involved as you listen to our next presenter.
Bravo, thank you so much. I'm learning so much here. This is amazing work. And we will now hear from Louise. And if people have questions, please feel free to put them in the Q&A. And of course, you can also put any comments in the chat. We'll be monitoring the chat as well. But if you have a specific question, please do put it in the Q&A. And over to you, Louise.
Great, thank you. I think I'll just start by saying now for something completely different. I'm going to talk to you about how we should be thinking about communicating this information and engaging the public and how the public is reacting to some of the ways that we do communicate with them on climate change. And I'm doing that within the context of the work we need to do to build a social mandate for climate action. We may think that there's a social mandate at the moment, but actually we are in quite a challenging period of time. And so my question to all of us and to anyone I speak to is, how do we do that? Can we build a social mandate for climate action? I'm going to share with you some results of research that I've done through Re.Climate in partnership with a network of groups that have come together under an umbrella called Eco-Analytics. And we recently completed a national survey of 6,000 Canadians that allowed us to measure not just climate change concerns and beliefs, but social and political values and behaviors to allow us to break the population into segments that I'll share with you with a bit of detail on in a moment. We then followed that up with 13 focus groups across the country that included people being sorted, if you will, by these population segments. And they fall into 5 categories. Let's call them the 5 Canadas. You may be familiar with the 6 Americas. And they break out on the left, ranked by their concerns about climate change itself. At the top is the progressive activists, which are the most engaged, the most concerned. It's about 15% of the population. A second group called civic nationals at 21%, centrist liberals at 20%, disengaged middle at 30%, and fossil fuel conservatives at 14%. What's interesting for me as a communicator is the right-hand column, where we see how the same segments sort themselves based on their social and political values. And we have this interesting group, the civic nationals, that are second in their concerns, and I mean really close to the progressive activists on concerns about personal impact of climate change, very concerned about climate change, yet they are quite socially conservative. And so the question that we need to ask as we build our campaigns and launch our thinking and strategies is, can we win? Can we build a mandate for climate action with 15% of the population? I'd argue that that's a challenge and that we need to build this social mandate by engaging other segments. And that may include thinking through how we actually communicate with more socially conservative Canadians. I mentioned the challenge of the moment that we're in, and we've got, as we're all familiar with, a dynamic social context where people have come out of COVID with inflationary concerns, cost of living, housing accessibility concerns. People's attention are distracted toward more security-oriented values, which displace your more collective-oriented values. And what we're seeing is an instability in climate beliefs. Surprisingly, sadly, all of it anxious generating for a person like me. We're seeing a decline in the Canadian population's belief that climate change is real and that it is human caused. One might say, how can that possibly happen? We've already heard about the issues of misinformation and greenwashing. They are having an impact, but it's also in a context where we have psychological gaps within the population itself. As Courtney talked about, the mental models are weak. In particular, people perceiving, despite you'd think with the impacts we're seeing day to day, perceiving that climate change is distant in terms of time and geography, and that there's really no social expectation that people will take action on climate change. The result of all of these things is we have seen significant decline in support for policy. Things like Rob mentioned, the clean electricity regulation being one victim. Hopefully, gladly, I see a sustained support for holding polluters accountable, which has not yet affected support for an oil and gas cap. So because I think about communications, I took advantage of the opportunity of being in focus groups to test a number of the ad campaign materials that CAPE uses, and I wanted to share with you the results. Here's one, which is an A/B test. The left side is what I would characterize as a more positive message, talking about the health benefits, the lives saved between 2030 and 2050 if we improve air quality as a result of shifting off fossil fuels. The right-hand side is a more hard-hitting campaign, rising childhood asthma rates, brought to you by oil and gas. And in the context of the focus groups, we asked people to do some polls. And by segment, we saw progressive activists. You might not be surprised by this. They were kind of leaning on both sides. They like the harder hitting piece. But look at those civic nationals in the fourth column here. Very much more in line or leaning toward a more positive message than the hard-hitting message. The criticisms of this, even though I won't be able to give you the time and the pleasure of hearing the people's voice, which is really why we do focus groups, but just in terms of advice and thinking through, one of the things, because of those psychological gaps and weak mental models, is that people's capacity to make abstract leaps is very small, very weak. And so you really can't leave anything to the imagination in our communication. So in this particular case, people's criticisms in the focus groups were the dates were too far into the future, and they really were hoping for some citations. Although because of the physician aspect and high levels of trust, there was some belief that there must be something behind it. On this particular ad, what's at issue here is that the more you move away from the most engaged segments of the population, the more you get a very strong reaction to targeting the oil and gas sector. That is for a number of reasons that people were quite clear in their minds about, one being that we use their products, that we are also culpable. Also, of course, they're exposed to misinformation. And so it's a risk in terms of other segments if we're going to do this. If we're going to target this sector, which we should, it's the largest sector in Canada in terms of emissions, the fastest rate of emissions growth, absolutely, but it's got to be explained. We also tested the fossil fuel ads make us sick. This is, I would say, from a focus group perspective, the most supported ad. They don't understand what greenwashing means. The basic things that we would just naturally say, people don't know what that means. They didn't understand how an ad makes you sick. We've got to make those tight connections in terms of how we communicate it. But this was really well received, particularly because they understood the tobacco references. Those analogies really work. On wildfires, I'm not going to talk about heat waves, but let me just say a couple of things. The imagery that we use is really, really important. For the love of all that is good in the world, we've got to stop using imagery around heat waves with people dunking their heads in water. There were a few things I did test on heat waves, and I will use that, bring that into my future presentations. But one person, two people, that is not a crisis. People really were looking for imagery that was showing multiple peoples, like a cooling center, and that demonstrated medical emergency, that clearly there was a medical intervention that was happening. On wildfires, people have a lot of anxiety. These images and the next two that I'll show you, neither of the messages, none of the ones I shared with the participants really worked. And that's a challenge for us. We've got to think clearly about the imagery that we use. And the fact that when people did look at these images, they talked about feeling stress and anxious, the tragedy of it all, how scary it is. And so as a medical community, I'm hoping there's a lot of thinking going on about what we're triggering as we're engaging in these conversations. Clearly, as we've noted already, the health and air quality piece is really important and coming up a lot. But for those civic nationals, they're the more socially conservative folks, it's not just the effect on people. They were very much taken by the effect on animals, what was happening to the homes of the animals who were innocent and not at blame for any of what was happening to them. In terms of this imagery, we may have to use a collage because it was very difficult to find the right combination to demonstrate the interface with homes and flames and air quality and evacuation. But the idea of showing people helping people, I think, is an avenue to test. There's also some new aspects for people. The fact that we've always had wildfires is something people understand, but now it's interfacing with homes, lives, livestock. As this one person said, it's not just somewhere out in the woods. It can happen where I live. And we've already talked about, of course, the health effects and people feeling trapped in their homes. Some quick advice on thinking about wildfires in particular. Before the events is the right time to be explaining climate science and forewarning of the weather, the extreme weather that we expect, clarifying the causes. During the events, it's a different kind of communication, talking about how climate change is driving this. There is no link in people's minds between wildfire and fossil fuels. That is a link we are going to have to work very hard to make. And then after the event, we can be thinking more about communications, about making sense and solutions and prevention and preparedness for the future. We also have a potential for a narrative that can talk about something like this: don't let Canada burn. If we want to stem wildfires and other extreme weather, we have to act on climate change. Climate change is causing more frequent, more costly, more deadly extreme weather year after year. Climate change is caused by fossil fuels. You can see the logic. We can't stop all wildfires or all extreme weather, but we can stop them from getting worse. The world is making progress on climate solutions, and so is Canada. We need to go farther, faster. And the game here, the point of our effort is that we need to be serious about climate change, and that means protecting people and nature from harm, holding big polluters accountable, and helping all Canadians do our part. This is fundamental to the research that we've done. People really need to feel we're all in this together. It's the blame part of it is actually excluding a lot of people. So let me stop there and stop sharing my screen. And you just got 10 minutes worth of an hour presentation. So if you have questions, I'm happy to answer.
Wonderful. This is great. So let's move right away to the questions. We have just a few minutes, and I will first, we have a question for Dr. Howard. Itai says, I'm wearing my public health hat and was hoping to hear from you, Dr. Howard. What are, one, the biggest priorities, and two, the largest gaps that you have identified in our public health system for action against climate change's health impacts? And I will ask you to respond briefly so we can take a few more questions. Thank you.
I think the most concerning gap is that senior leaders don't know what they don't know. So we surveyed everybody leading planetary health at all of the different universities, 50 other people. Number one, the people in charge who have social capital, political capital, financial capital, have never read anything in a journal, don't know what they don't know, and are leaving more junior people and learners who are going to be disproportionately impacted in a terrible position of trying to brief up. So if you are listening and you hold any power in a medical faculty, please make it your business to go book coffee with your dean, have them see you, have them trust you, you're a normal person, and give them a journal article. That's what we need. Thank you.
Okay, we have quite a lot of questions. I'm going to have two for you, Sehjal. The first one is regarding Vision Zero. Nice pull from the Swedish active transportation policy. How will you attain zero if you have non-compliant individuals? I have patients who live in Ottawa community housing, south-facing cement apartments in Lower Town. They refuse to believe that the heat is dangerous for them. I appreciate the goal, but I don't think zero will be fully attainable. And this comes from someone from the Ontario Nurses for the Environment. And a second question to you, Sehjal, which
If it disappeared, I might have answered it. Hee hee.
Okay, go ahead then.
It was about the public health residency program, so I typed an answer.
Great.
Okay, perfect. Thank you for the first question. I think it's an interesting question, and maybe we work at the same clinic. I actually am at Centertown Community Health Center, where I do work a lot with an inner city population and people living in subsidized housing. I think that the main problem is we focus a lot on individual responsibility when it comes to these things, and like trying to convince someone extreme heat is an issue is maybe a losing argument, and sometimes it's just up to policymakers and us as physicians and nurses to try and do our best to educate and provide an environment around the people who may not understand that or don't have the bandwidth to understand that or the privilege to think about preventing a crisis because they're more concerned about where their next meal is going to come from or where they're going to sleep. So I think it's about providing a social safety net using these policies and trying our best to continue to educate about being prepared in case of a worst case scenario. I don't know, like, it's hard to convince people that this is an emergency, but maybe you could communicate some of the health risks and ways to identify the impacts of extreme heat if they were to experience it, and then be open for more communication as they feel ready to warm up to it. But I think it's about reducing the individual responsibility and more about kind of creating those policies and those environments to live more healthily in.
Thank you. I have a few questions here for Louise. So I'll just collect a few of them, put them together, and we are making our way quickly through some of the questions. There's also quite a few about the slides and so on. So we'll tell you a bit more about sharing information at the end. But Louise, firstly, there was a few questions regarding the definition of civic nationals. So if you can define that more clearly. There was another question about seniors in Canada make up 25% of the population. Is there specific messaging needed to reach this demographic, which are more vulnerable to climate impacts? And another question for Louise. Should we spend energy trying to reach the fossil fuel conservatives, or spend all of our energy trying to mobilize those who are already very concerned?
Awesome questions. So the definition of civic nationals is that they are very concerned about climate change. Almost 70% of them say they are very concerned. About 35% of them say that they believe climate change will affect them personally, which is the same level as the progressive activists. So from a climate point of view, they're really in alignment and allies, very concerned. But they tend to come at it from a nature point of view. These are folks that are conservation oriented, who are hikers, campers, all of that aspect of it, and who are very engaged with nature conservation groups, birding, that kind of thing. And they're socially conservative on a number of fronts. They're currently concerned about high levels of immigration and the stresses that that's bringing from their perspective. They are very much more in line with traditional family values. And they are concerned about rights-based advocacy in terms of various aspects of the population. And so they have a particular perspective, yet they are very keen to engage on climate. I'm so glad about the question on seniors, because we are part of a growing campaign called Seniors for Climate. And leading up to a day of action October 1st. And one of the things I would really love Kate to do is to actually put out on that day, which is Seniors Day, a brief on the effect of climate change on seniors. I think it would be just super and really helpful. I've also asked all my other friends at other organizations to put out reports on that day. Fossil fuel conservatives, no, there's not really much point there. The issue for them is really one of identity. We've got a lot of work to do with other segments of the population. And so the recommendation is really to focus on the progressive activists who care but aren't really mobilized, engaging with the civic nationals and the centrist liberals, and some of the disengaged middle we can maybe do. We got lots of work with those groups, and so that's where we should put our attention.
Muted. Thank you for those wonderful answers. And we do have a few more questions about engagement. The question is essentially, who should we be partnering with and how? So we have questions, where are we partnering with industry, firefighters, companies manufacturing heat pumps? How do we best partner with municipalities, local health departments, and ministries of health? And also, can physicians directly advocate for forest management policies to decrease forest fires? So I think that's the last question we'll take. We'll be going a tiny bit over time. I will pass it to Courtney. First, if you want to say something, we can do the last tour de table, and then we will close for the evening. This has been such an amazing webinar and really a lot of information. Thank you, Courtney. Go ahead.
Thanks. My focus for the next year or two is to get academic health institutions on board. And that's because they train the physicians of today and tomorrow. And it's not okay for doctors to not know how to treat air pollution. It's just simply we're not fulfilling our clinical mandate, and that is basic clinical competence. That's why people trust us in the first place. So if you have any pull with your local academic health institution, please, in-person meetings matter. Emails are one thing, in-person meetings are another. Pull over your deans, say sustainable healthcare is a priority for me. It's the #1 priority for the World Health Organization. Let's make a plan, and we need to dedicate actual money to that, because the poor people who are trying to lead that work right now are doing it off the side of their desks, and you can't really save the world off the side of your desk. So please make that a priority. That way we can build our trusted network quickly and serve our patients properly.
Thank you. Over to you, Sehjal. Thanks, Courtney.
I get closing remarks.
Sure, go
This
ahead.
is okay. I just want to say thank you everybody for coming and to get involved with local climate organizations. You don't have to do it all on your own. There's organizations that exist that you can give your energy to. And hi, Courtney. And yeah, any effort is worth it. Take care of yourself and then try and take care of the planet too.
Thank you so much. Louise, did you want to?
Yeah, just a quick thing on partnerships. So in this particular case, when we're talking about wildfires, it's pretty clear from the research I do that people want to hear from firefighters. They want to hear from researchers, scientists who work on the ground within forest ecology and wildfire behavior and that kind of thing. On heat waves, obviously the go-to is the medical community, but on wildfires, it may be a factor of sharing the mic a little. And partnering with groups who are helping firefighters and other fire-related expertise build their communications capabilities. And thank you.
Thank you so much to everybody for joining us today. Thank you so much to the panelists and to the amazing work that you're all doing. My colleagues are putting some petitions that we would invite you to sign. One for the fossil fuel ad ban that I don't know if I mentioned, I'm the director of the Fossil Fuel Ads Make Us Sick campaign. So this was also a lot for me to integrate into my campaign. And today's actually Clean Air Day is our 2nd campaign anniversary. So please do sign the petition. And I believe there's also a petition about the emissions cap that will go into the chat. And as I said, there's a lot coming. So we will be sending the recording out to everybody. We saw the request for different information about sharing slides and sharing data. So we will be following up with all of you. And remember, stop, drop, and roll. Stop the disinformation, drop the emissions, and roll out the climate solutions. And have a wonderful evening. Thank you so much.